the most important thing and a very important way of belonging to ourselves is to be true to our own desires, right? To be true to who we want to be and to not let our fears or the need to please other people or the idea that we have to earn our value be the determinant. Those are all versions of self-betrayal. The goal is, how do I be true to the best in me? How do I be true to my desires? How do I heal my relationship to my own body? That's the goal. Whether or not you're ever sexual with another person, whether or not you are ever sexual at all, right? That's on you to decide. But I think you being true to the best in you is the most important thing. So we're going to talk today a little bit about trauma. Let me just say a couple things before I jump into some of the questions. One is that some of you are joining for the first time to this educational session, and you may not know that these educational sessions, these free resources that I do once a month, are connected to the Facebook group Ask an LDS Marriage and Sexuality Therapist. So that is a group online where people can come ask questions of one another, and then we every month will collect questions around a theme. Christy collects them, and then we, my participation in the group is largely through teaching ideas that people are grappling with, trying to make sense of. And so we've had a lot of questions come in around trauma, and I just thought, it's not an easy topic, but maybe it's time for me to teach about it. So the second thing I just want to say as a reminder to everybody, and you all do pretty well around this, but one of the things that I value very much is the ability for people to deal with differences in a civil, decent way. We are in a society right now where people have a deeper freedom than ever to be indecent, judgmental, harsh, cruel around differences. And this is the thing that's going to break us. It's what hurts marriages, it's what hurts relationships, is the real challenge of being true to our own beliefs and thoughts without going into telling other people how to think and feel and going over the line. So I created a video about this that we will try to pin to the top of the page, but just a reminder to everyone around what's accepted and what isn't. You can share any opinion, but you can't be mean. And if you are, then you may get dismissed from the group, because that's how important it is to learn how to do this, because it's essential to all your relationships, not just participation here. So with all that, we'll jump into our topic in talking about sexual trauma. So let me just pull up my notes. So let me also just give a few, I don't know if disqualifier is quite the right idea, but just talk to you a little bit about kind of who I am. And, I've done quite a bit of training around trauma and treating trauma as a licensed therapist. I did a lot of work with Pia Melody and then some with Dr. David Schnarch in treating trauma. But that said, it is not the focus of my work as a couples coach. So while I am a licensed therapist, I don't do mental health counseling anymore. My work is really around giving coaching, as in not treating mental health, not treating trauma, but giving coaching to people who are wanting to increase the depth and quality of their emotional and sexual relationships. So while I have training in this area and I have thoughts about this, I, for one, be clear that I'm not functioning as a mental health therapist in giving this input. I'm just using that experience to speak to this, and to not take anything I say as more important than what your mental health counselor is guiding you in if you are getting treated for trauma. All that said, I think it's fair to respond to some of the questions that come up and how you might think about what's happening if you are a survivor of trauma and are trying to create a sexual relationship in marriage. So, so Dr. David Schnarch, that I trained with for a number of years, used to say often, we want more to belong to ourselves than we want to be sexual. And this is a foundational idea of all good sex. So we will not have sex that's good for our souls if we don't belong to ourselves while being sexual. And so this is different than whether or not we'll be aroused or even orgasm, because you may get aroused or even orgasm in situations that are very bad for your soul, or where you feel that you aren't being true to yourself. But to have sex that we find desirable, sex that makes us joyful, sex that makes us feel more whole, then we have to be true to ourselves um, while being sexual. Okay. So when someone doesn't desire sex in partnership, as you've probably heard me talk about, it's because they don't feel free there. They don't feel free to be themselves. That might mean that they don't feel accepted, right? They don't feel that their partner thinks they're desirable, or they feel that they need to produce something, solve something in their spouse, right? That they have to be a kind of caregiver to their spouse. Um, or they feel disappointed in themselves and they're very judgmental of themselves, even if their partner is not. These are all things that are going to make us not want to have sex, or if you feel taken advantage of, used, right? These are all going to be things that make you not want to be sexual. And it's also true, just to kind of hold this thesis of wanting to belong to ourselves more than be sexual. If being sexual makes you feel more like yourself, or you trying to be sexual because you want your partner to want you, to respond to you, um, or you were told that you're, a sexual deviant in some way. And so being sexual is sort of being true to this identity that is even a negative one, then you may also be sexual because it's in line with the self that you're trying to be true to. So the basic idea, though, is this belonging to ourselves is a more important definer of our relationship to sex than just the physical desire for sex in and of itself. So when there's been sexual trauma, and to be clear, there can be minor sexual trauma, one person, one incident when we were an adolescent with somebody who didn't matter much to us, and I'm not diminishing that, right? But that's one level, versus as a young child with someone who was supposed to protect us over years of time, right? There's a real spectrum in terms of how damaging it is to our relationship to our sexuality. But um, usually the brain responds in some way to protect you from trauma. And a very typical way to do that, to protect your sense of self, is what I mean to say, is to shut down your relationship to sex altogether, or to not show up for it, at least, right? So even if you're sexual, you aren't really there in the way that you might be, because you're busy protecting your soul from further harm. And um, whatever your response is to it, it can be very easy to be judgmental towards yourself, to be harsh towards yourself, to say, I'm having the wrong reaction, or an overreaction, or a reaction that makes me feel ashamed. But I think it's important to understand that there is a wisdom in the body. And even if it's helping a little too much, right, which sometimes it may be, to still understand what the body is trying to do. And its primary goal is to protect you. So being really judgmental is not particularly fair. That is, the body is trying to protect us from further harm, from exploitation, from not being able to be true to ourselves. The challenge, though, is that, or at least it can be the challenge, is that often in this overprotect, let me say it a little differently, often in our bodies attempt to protect us, um, and cutting us off from our sexuality, or teaching us that the body is not safe, sexuality is not safe, or the idea that our body is the problem, or that we are somehow inferior and we drew this kind of sexual attention to us, right? We can come up with meanings that um, is our body's attempt to protect us, but that interfere with our ability to be at peace with ourselves, at ease in our own skin, able to accept our sexuality, our God-given sexuality, able to accept our capacity for pleasure. Like when we have had sexual trauma, it's very easy to want to just divorce ourselves or divorce our souls from our sexual nature. And uh, to be clear, I'm not saying anybody needs to rebuild that bridge. You don't have to. Everyone has to determine for themselves what matters to them and what they want to do. But um, but that in that division, we often feel more fractured inside. Even though it's trying to keep us safe, we're kind of divorcing a fundamental part of being human, a fundamental part of being at ease in our own bodies. And it can undermine our strength. It can undermine our self-acceptance. You know, very often healing from sexual trauma or any kind of abuse is to connect to the truth of our own value, to believe in our own ability to have pleasure, our own acceptance of our body, acceptance of our sexuality, acceptance of our flawed nature. That's often what it is to grow into wholeness and to grow out of the meanings that the abuse instilled in us. So, and just to be clear, none of what I'm saying is about you doing what you should do. Okay. It's like nobody, you know, anybody who's come out of trauma gets to decide for themselves where they want to push themselves, if they want to, what they want to heal, if they want to. But the most important thing and a very important way of belonging to ourselves is to be true to our own desires, right? To be true to who we want to be. Um, and to not let our fears or the need to please other people or the idea that we have to earn our value be the determinant. Those are all versions of self-betrayal. The goal is, how do I be true to the best in me? How do I be true to my desires? How do I heal my relationship to my own body? That's the goal. Whether or not you're ever sexual with another person, whether or not you are ever sexual at all, right? That's on you to decide. But I think you being true to the best in you is the most important thing. So somebody asked this question. In the Art of Desire course, you talk about how when you've experienced sexual trauma, the desire to shut down sexuality altogether can be very high, but that shutting it down is a huge cost to us. That when you shut it down, it undermines our strength, authenticity, and passion. Can you help me better understand how and why this happens? Why do you lose so much more than just the desire for sex? So again, we can lose the desire for sex and have it be 100% good judgment. Okay. Like that is, our brain is saying it's not wise to be sexual here, right? Because we're with someone who doesn't care about us. We're with someone who has framed sex as something that you owe to them. Um, or you're with someone who's not being honest with you and so on. So it can certainly be wise, good judgment, and absolutely being true to our higher selves to not be sexual. So the goal isn't being sexual per se, but it can be the lack of desire for sexuality, sensuality, pleasure, can be about a ruptured relationship to ourselves. It can be about a ruptured relationship to our own bodies. And I think if we're afraid of our bodies, if we're afraid of our own capacity for pleasure, if we're afraid of our eroticism, then I think it can interfere with being truly at peace in our own skin, truly being able to accept our humanity, um, and to be able to take in the joy and the goodness that's around us through the body. It can interfere. So it's more, am I living my life by fear, or am I living my life that's in line with the self that I really want to be? And not, again, no one needs to be sexual. No one has to um, deal with this part of themselves. And you can still live a good, rich life, especially if it's being true to what you really do desire. When I have worked with people who've been in sexual trauma, when they're thinking about their relationship to sexuality as something that was taken from them, and they want to restore that for themselves. That's the meaning frame in which people say, I want to deal with my fears here because I want to be whole, because I don't want what this person took from me to determine my life. It's an assertion of self. It's an assertion of, I'm reclaiming my life. I'm reclaiming something that matters to me. And that's when I see people make significant strides, because they're not doing it to keep their spouse happy. They're not doing it to prove that they're not broken. They're doing it because they don't want that perpetrator to have any more control over their lives than they already had. And this is a way of reclaiming their whole selves, their sexuality being an aspect of that. What you do with that reclaimed sexuality is still 100% on you, the chooser. But being able to belong to yourself once again. So this person says, my spouse has been working through her past childhood and adult sexual trauma for the past 8+ years. She's been seeing a therapist during this time. The effects on her desire for intimacy, wanting to know and be known, are significant. Our 30-year marriage may not survive. I see the negative effects, it sounds like, on her desire for intimacy have been significant. Our 30-year marriage may not survive, partly due to her aversion. I want to be supportive and offer the love and grace she deserves. I'm struggling with how much accommodation and at what cost is enough. I are on our 5th marriage counselor. She hasn't been very willing, assuming my wife hasn't been very willing. She hasn't been a very willing partner in working towards resolving current and past issues, including a healthy sex life and a 25-year-old affair on her part. Any advice for how to best decide when to take no for an answer? Okay, so what I would say is, from what this person is describing, and without me knowing any more specifics, it sounds like the person writing this question is in a marriage where your wife is saying no to a more intimate marriage. The key sentence I see in that is, quote, she hasn't been a very willing partner in working towards resolving current and past issues, including the 25-year-old affair. So that is to say, what I see in this question is that your wife doesn't appear to be choosing to sort out who she is in order to be in a marriage. So there's a real difference between, and sometimes it's not easy to explain this, but between somebody who really is saying, I want to deal with my sexuality. I want to deal with the unhappiness in our marriage. It's going to be hard. It may take longer than either of us wants, but I want to deal with it. And their behavior backs it up. They're getting the therapy they need. They're trying to figure out, how can we have more connection? And how can I face my fears more? But they really are trying to build a marriage, even if it's a cumbersome process. Okay, even if it takes a lot of patience, right? The motivation is there, which is different than trying to convince someone that we're trying and they should just be more patient and not want this so much. Okay, that's a different idea. And part of the evidence is just in not being willing to work with or address issues that have been hampering the marriage outside of sex, per se, right? So we can use our limitations, whether it's from trauma, whether it's other places that we struggle in our lives, as a way of, we can tell our partner that we're trying, but it's more of a way of just exploiting their hope. It's a way of just getting them to tolerate things as they currently are, while trying to convince them that we are doing our part when we're not. Now, again, I am not here to say that anybody has to deal with their sexuality, their sexual trauma. They don't have to. What I think, though, is we owe it to our partners to be fair with them about what it is we're actually doing or not doing, what we're willing to address or not address, so that they have a real choice. They also, I'm not here to say what they need to choose. They may choose to be in a marriage that's sexless or relatively sexless. They may say this is still the better thing, is to be here knowing that it's never going to be a sexually intimate marriage. But being careful not to exploit hope, or even tell ourselves we're trying to do something that we're not trying to do, which is what I see in this question. I mean, just like another example of this that um, came up recently with somebody I was working with, where he's telling his wife all the time that he's trying to stop looking at porn. But his behavior, and you always want to look at behavior more than what we say about our behavior. His behavior is basically, I want to convince you to see me as someone who is trying, while I keep this in my back pocket as an option, while I keep having porn in my life, even though I know you don't like it. And so, um, my suggestion to him was, why not just be more honest about it? Like, then your wife has a real choice. Like, just bank on the fact that I'm going to be looking at it regularly. Okay. Then she's free to decide what she wants to do. But this whole idea that I'm trying is a way of keeping her in a false hope, and even yourself in a false hope, without looking at your behavior to see that, no, you don't want to actually let go of this. And again, I'm not even telling this person he should. He really gets to decide. What I'm saying is, the more honest we are with our partner, the more we can figure out if we can back up our own position, and the more we free our spouse up to make decisions that they can live with. So again, no one has to deal with sexual trauma in a marriage. No one has to be sexual. But the more honest we are with ourselves and our partner about what we really do desire, the more we can get on the right muscle. Either I'm going to make my peace with not dealing with this part of my life. There's been too much pain, too much sadness, or I want to deal with this part of my life. And if you're in the position of, I do want to deal with my high reactivity to sexuality, I do want to deal with my sexual trauma, for me, for my own peace of mind, well, then you're in the mindset that it's possible, because you're doing it out of a self-defining, self-authoring energy, not out of, I have to do it. Same with going back to the example of the person with porn. If he's saying, I don't want to be somebody who's always hiding, who's always doing something that undermines my wife's respect for me and even my self-respect, which was true for this person, um, then he's in the right muscle to say, I don't want to do that. Okay. Because I don't like living in this split reality. It's going to have a different impact on him than I have to give this thing up so my wife's not mad all the time. That's going to keep him hiding and in a division and in resentment. So getting clear within ourselves about, where do I want to push myself? Where do I want to be? What I care about in people finding their strength is being more deeply aligned. The person around the porn could say, look, just know that I'm going to be looking at it. I mean, at least that's more aligned because it's more honest. Or he can say, look, I'm not going to look at it anymore. And I'm making a commitment within myself that's in line with what I want. Around the person around sexuality, to say, I'm never going to be able to do this. I don't want to do it. That's aligned. Or I want to address this for myself because I want something for myself in a different way. That's also another version of being aligned. So getting aligned is our biggest, it's the most important factor in being able to move into greater strength within ourselves. And we're often up against really hard issues. when we get aligned, usually why we resist it is because we have to give up something that scares us to give up. Um, or we have to face something that scares us to face. And someone that's come out of sexual trauma has a lot of good reason to be afraid of confronting their eroticism and their sexuality. And so I'm in no simple judgment around it. I'm simply saying that it's going to be easy to want to straddle because it's scary to move into the areas of our life that we tend to regress around. Um, so to this point, somebody writes this question. I was sexually molested for the first 3 years of high school. I'm now 47 and I've been married for 22 years. Even when I want to have sex with my husband, once it goes past making out, and especially when I orgasm, I'm afraid and instinctively want to pull away. I've gone through a lot of counseling and it's helped. However, unless I have zero stress in my life, a few months or so very, very rarely, I just don't feel safe during sexual activity and I'm unable to express myself sexually with him. I know that I'm safe with him. Okay, that's very important right there. She's saying, I know that I'm safe with him. He's proven that. Is there anything I can do to finally be free of my past trauma and enjoy myself sexually with my husband fully? So this in my mind, just reading this, is this kind of duality in which your higher brain knows something, but your lower brain does not know it. Okay. And so that is, I know I'm safe with him. I don't have any rational reason, but my lower brain, my limbic brain is not having it. And when we tend to get aroused and sexual, our limbic brain is there monitoring the situation very carefully, okay? Especially if there's been trauma, because the limbic brain is mapping your mind body, mapping your mind body of your spouse, and trying to sort out, is everything safe here? But even if it is, the limbic brain can get too helpful. It can be in there trying to um, scare you out of behavior that in the past was traumatic, was bad for you. I mean, anyone who's experienced any kind of a trauma, even like a car accident, right? Something that not as personal as sexuality. That, I remember when I first learned to drive, I hydroplaned at a stoplight because it was raining, there was grease on the road, and I slid underneath a truck and it just like rumpled the roof of the car. I still can times be coming up when it's raining and putting on the brakes and have like an overreaction inside of me because that was a scary moment that sort of, got embedded into the limbic. Okay. So the limbic can get in there and be super unhelpful. And this is where trauma therapies that work with the body are the most helpful. You can work with the mind. Okay. You can say to yourself, look, I'm perfectly safe, perfectly safe. But the prefrontal is not great at helping things at the limbic level. And so this is where I am less trained, okay? And there's lots of EMDR therapies and other therapies that are working with the body. And I'm hoping that our profession will continue to progress in its ability to utilize the body to heal trauma, because I really think that's where we have to work. But one thing that can be very helpful is and Dr. Schnarch this was primarily the way that he used to talk about it, is you want to stress your brain enough to be a little uncomfortable. I'll explain better here in a minute, but not get to where you're regressing. Okay, so Schnarch thought would talk a lot about the fact that you can use the body to heal the brain. And when you use the body to heal the brain, it's much more powerful than, and especially positive sexual meaning is very powerful for healing the brain. So he would say like sexual trauma has a very negative impact on the brain because it's so close to the bone, but just as positive sexual experience has a very positive effect on the brain. And so he worked with people around helping them move into collaborative experiences together that were positive, but not pushing the brain outside of where you could stay in some meaningful contact with your partner. And so he had exercises. These are in my Enhancing Sexual Intimacy course, like hugging till relaxed um, is one of them, where you're spending time just settling the body down before you're adding any erotic element. And it's not just Dr. Schnarch who recommends this, other sex therapists work with this. You need this foundation of anchoring into yourself while you're with your partner. And that is really, really important for solidifying belonging to ourselves. So, for example, I had a client who was raped when she was in high school, and she just had a lot of understandable reactivity to sex. She was married to a good man. She knew he was a good man. And yet, when she would become aroused and so on, her mind would just go into this regressive place. But also, just tracking her husband's arousal would make her feel like she needed to be sexual, and that would trigger the limbic brain into the kind of panic and the fear. And so she started working with me without her husband there, and um, just started talking about how disconnected she felt from her body, from her sexuality, how she didn't feel connected to either when she was with her spouse. And she was, she made a decision in our conversations that she just wanted to be in the sheets with her own skin on the sheets, and to not, you know, to not make it about her husband or anything. And so she was someone who wore garments. She took them off. She put on prettier underwear, and her husband was asleep and would just climbed into bed next to him, and just feeling at peace in her own skin, in her own body, not feeling like she owed anything to her husband, like she could belong to herself and her sensual embodied self. She also felt attractive. Now, this is important, but it's just like she felt her own desirability in a way that was true, right? Just being with herself. Well, she woke her husband up, and he's like, wait, what? What? And then he sees that she's in like this attractive underwear. And so they had sex, and she enjoyed it a lot. He had zero expectations because sex was not something that happened much between them. But she did the next thing the next night, and then the next night, and the next night. And she kept desiring sex because she would have this ability to belong to herself. And because he had zero expectations, really, she continued to feel in control. What happened though is, after a little while, he's like, hey, you gonna put on that good underwear again? And hey, are you gonna like wake me up? Okay. And then her desire, of course, started to plummet, because this sense of I'm in control of myself was going down. And that I don't owe anything, that was going down. And so she was losing track of this feeling of belonging to herself. So I may come back to that story because they made progress in another way. But um, so one thing that couples often do is they start to get ahead of where they can be together, of where they can be connected. Whether or not there's trauma, this is a problem for couples. And they are too goal oriented, or seeing sex as something to be that's about intercourse and orgasm, rather than how can I settle into my own sense of self? How can I ease into my body, belong to myself, and then be with you, right? Take pleasure in being with you. How can I do that and stay connected to myself at the same time? That's the goal. And couples that make progress don't, they keep that clear as the goal. Because, just to back away from sexuality for a moment, the way that we can work with the body to treat overreactive limbic behavior is to be in this uncomfortable place of dysregulation without being triggered. So, somebody who might have obsessive compulsive thoughts, the most effective treatment is to think about the thought that scares them. Let's take it to something like, let's say they have an intense fear of spiders, right? Well, the way that you might deal with that is you figure out kind of what's the hierarchy of fear. What's the most terrifying thing, like holding a spider? Then it might be seeing a spider. Then it might be seeing a spider in a cage. Then it might be seeing a spider in a cage across a room. It might be then seeing a picture of a spider. It might be seeing, the picture of a teeny, teeny, tiny spider that couldn't hurt anything, right? Then, and so on. So you get down to kind of what is the level, and then it might be thinking about a spider. Okay. What you do is that a good therapist helps that client, and that client also helps themselves in other moments, non-therapeutic moments, of purposefully stepping towards the thing that stresses them, that drives limbic reaction, while calming themselves down, staying centered in their sense of self as much as they can. Now, they might said, oh my gosh, there's a picture of a spider. I'm getting dysregulated, but can I work with my fear right now and calm down while I keep looking at that spider? And the more they do it, the more their brain, their limbic brain figures out, you know what? We're not going to die. Like, the spider is not going to get us. And I actually can belong to my sense of self and look at that spider. Okay. Um, and so the more we do those things, the more that our brain starts learning that this isn't as unsafe as we think it is. So with this client who had suffered rape when she was an adolescent, she started having her husband touch her in a sexual way, and was really working with like how soothing herself, calming down. She wasn't touching him, she was being touched. This for her was anxiety evoking, but not putting her over the top. Okay. So you have to figure out what your hierarchy is of what you can handle. What's way too much versus what's something that stresses me a little bit. You want to think of it in terms of like exercise. When you go to the gym and you want to change your muscle strength, you want to be at about a 7, okay, out of discomfort. I know this is very subjective, but you're uncomfortable, you're looking forward to it ending, but you're not going to hurt yourself. And psychologically, that's also a good place to be when you're working with somebody who has obsessive fears, that you're finding where is that workspace of it's uncomfortable, but I can still hold on to myself, calm myself down, and work the brain a bit. Sometimes what happens is that when people do that, then they rush to, well, that was okay. I should really have, now going back to the sexual part. Okay, well, he's been so patient. We should just have sex. And they self-betray in a way, and they jump into behavior where they're not really being true to themselves. Everybody wants control of themselves. Now, when we're unhealthy, we try to control everybody else, and we control how exposed we are. The thing that doesn't ever really change is that we want to feel in control of ourselves, and the sexual self does, especially. It's vulnerable territory. Even when somebody can surrender into pleasure, they aren't letting go of their sense of control. In fact, if they don't trust that their partner would stop if they said to stop, they're not going to surrender. Okay, so that is to say, they know that they ultimately can do what is in their interest. And so what you're doing when you're working with sexual reactivity is you're stepping in a line upon line, stepwise fashion into more exposure while calming your mind down, so that your mind can feel that you can handle this situation, that you remain in control. And it can be a slow process, but it's a way of teaching the brain when it can let go of its job. It's in overreaction because it feels it has a job to do. And until it can understand that you're going to take care of it and it doesn't need to be there vigilantly, terrifying you out of all situations, then it can calm down and move on to um, to more immediate and true risks, not the ones that you fear. Let me say one more thing about this before I maybe look at another question. But this same client was making a lot of progress. And this is also not unusual. And just to kind of help you understand that this can happen. She was making a lot of progress. She was opening up more and more to her spouse. She was feeling more loved by her spouse. She was getting more comfortable with sexual exposure. And then one day she just had sort of an immediate regression. Like she just kind of crashed into her fear. And that's not unusual. It's like the brain's like, wait a minute, what are we doing? Like the limbic brain has kind of just been settling down. And then suddenly it's like, wait a minute, I haven't been doing my job and this can't possibly be safe. And you kind of go into a regression. And it can be very uncomfortable. It can be very hard, and your brain can be very much trying to convince you that you are doing the wrong thing. And again, being compassionate with yourself, taking time with yourself, right? Not judging yourself too harshly. And then ultimately coming back to the question of where do I want to push myself again? What do I want to do to around this? Do I want to step back towards my fear? Do I want to let go of this challenge and not do it? But again, the reminder to yourself that you are ultimately the decider about what you want to work on and or what you don't want to work on, because that's what your brain needs to know to settle down. If the limbic brain can learn to trust you as as the self in charge, right? It's going to settle down more. This person says, years of duty, consensual but unwanted sex with my husband has left me unable to desire him sexually or be intimate with him. We can have sex, but it's not intimate for me. Can someone who's experienced sexual trauma from someone they love and want to be intimate with ever heal? Once we face the damage we had caused, my body has a repulsive reaction to being touched intimately by him. Um, so what I would say is it kind of comes back to this question of desire again. Yeah, I mean, it can be very hard when you have loaded in a lot of meanings in a particular direction. To truly undo that, to truly change that requires at least two things. One is it requires that your partner really is in a different position, right? That they're not doing the same thing, that they really want something stronger and better, so that you're actually interacting with a different partner, and that you want enough to build a new meaning there, that you want enough to really create something. If it's still in the frame, well, okay, I have to because we're still married and I really should do this, you're going to have repulsion like crazy because your brain's like, no, we are done with that. We're not doing any more of this kind of subservience in sex. And if you're keeping it in a meaning of I have to, you will feel intense repulsion because it's, again, the sexual self wants to be in control. And um, so you have to push yourself on that, and you may be up against a hard choice. Am I going to be honest and say, I don't want this, and I just don't think I'm ever going to want it, and I don't see myself, um, I don't want it, and I realize that you may then decide to not stay, or you may be upset with me, but this is not something I want to work on with you. That's choice. That's door A. Door B is, okay, I want to create something different. We may have to back way down from where we have been, but I want to create a different meaning with you. I want to create a meaning in which we are building a sense of friendship sexually, that we're building something that's about the two of us, and it's going to take time, but I want that. Okay. That's important because again, you have to be in that place of control for something new to emerge there. I'm not saying this would be easy, but it will definitely not happen if it's not something that you really do choose and desire to create. Any questions that have come in or anything that you think or that you would ask Christy as a listener?
question came in. Let's see. She said, my trauma involves seeing sex as the other woman. Men are more interested in getting to her, and I am just the skin or means to get to her. Sexual interest, therefore, feels dangerous or untrustworthy at best, even from a safe man. How do you trust it?
Okay, well, a couple things there is one, there's a little bit of a contradiction in the question, which is fine. All clients have contradictions in their questions, but that is to see it better is that the kind of the basic idea is that men are not actually interested in me. They just use me. Like I'm not desirable to my partner. I'm just a means to an end. And I don't want to be devalued or objectified, which perfectly makes sense. And I'm married to a good, safe man. So that those are two different ideas. And I think that it matters to reconcile those two competing ideas. Is it that I've been used by other men, other situations, but not this one? Is it that this element was there but isn't there anymore? Um, but is this really someone that loves me and chooses me, even though I have, and it might be this based on how the question's written, this person loves and chooses me, but I have this fear that maybe I can't see what he really desires, or maybe that I really am not enough. And so I think it really does still require like, so let me back away for a second. I'll come back to the question, but a part of women's sexuality in general is this sense that they are desirable, that they are the turn on. And when that's been damaged by being married to someone who has found other women to be a turn on, or that they don't feel they have their spouse's sexual energy oriented towards them, it can be very easy to feel used, to fear that you're not enough, and for your sexual self to shut off in that context. Um, there's two ways to address it, which is, does my spouse really choose me? And does my spouse see me as desirable? And how does my spouse see me? Like, what is it that he sees about me? Is it how it serves him, or does he love me as a whole person? Right? Because if he loves you as a whole person, then that is a valuable sexuality to open up to. Is the struggle about my spouse, or is it my relationship to my own sense of desirability? Women want to feel desirable, but we also have a very self-reflexive, self-judging inclination that can make it really easy for us to see ourselves as undesirable, imagine other people are much more desirable, like in a way to discredit our own beauty, attractiveness, and how compelling we actually are, and put that self-doubt onto our partner, right? Like, how could they possibly be attracted to me? Have they seen these stretch marks, right? Like that we can do that. And they're like, what stretch marks? Like, my gosh, like you're everything, right? That it might be hard to believe it if you see yourself in this very objectifying way. So you want to assess, who is my partner relative to me? And then am I able to believe in my own desirability? Can I be that representation of feminine beauty? Can I believe in my own ability to be that? Not from some objectified measure, but like because of who I am, because I am a woman, right? And women are beauty. Let's own it. Let's not deny it. So that's the piece to get worked out.
One question I get in the inbox a lot is people who are maybe hesitant to take the online courses because they have a history with trauma. Do you think the online courses, what would you say to someone in that situation? Are they just a good supplement to working with their therapist, or would you wait until?
Yeah. Well, I definitely think supplement to certainly with working with a therapist. I think, the Art of Desire, for example, at least the first half is about how to belong more to your sense of self, how there are cultural elements and elements within us that allow us to kind of self-betray in order to stay in connection with others. And when we do that, it undermines our self-trust. it undermines our trust in our relationships, and it undermines our sexuality. And so that's just a kind of foundational piece that can be valuable for healing your relationship to yourself. So remember, the sexual self wants to know that you're not going to betray it, that you're going to stay in control. And so learning to be truer to yourself is the foundation of eroticism. The second half of the course is helping you better understand female sexuality, and in many ways to better understand why you've been as picky as you have been, or as unwilling to just jump into sexual connection if it's not being true to something in you. And so it can help you better see either what it is that you need to work with in your relationship or in yourself to make the relationship healthier. The goal of the course is never about you should be more sexual, here's how you have to do it. Okay, so I think that's what people often are afraid of, is that it's about, or like some simple idea of purity culture, I'm here dismantling it. It's much more about how to be true to the best in you. Mhm.
Awesome. I just had three good questions come in. How do I help my young teen daughter develop her sexuality in a healthy way as she's recovering from sex abuse from a close family member?
Oh gosh. Um, yeah. So, well, the more that she can look at you and see your peace with yourself, your acceptance of yourself, and your acceptance of her, the more she has another mind to reference um, about who she is and what she's worthy of. So good eroticism is always based in this basic sense of our worth and our value. And that's when it's good for our souls. So she needs to know that what happened to her was never about, I mean, I'm sure you've said these things to her, but she needs to feel ultimately that this wasn't about her and this was about an exploitative other, and that she deserves to be joyful in her life. She deserves to protect herself, and she deserves to belong to her sexuality for her. That's the core idea. And if it takes her time, it takes her time, but that something was taken from her that always belonged to her and never was anyone else's. And she has your blessing in reclaiming it for herself in her own due time. And you believing in her and you believing in yourself, right, as a woman, is the most helpful thing as she works through those meanings.
Oh, Jennifer, I have three. Can I go through them really fast? Or I'll go through as many as I can.
You got 4 minutes.
I'm newly married and afraid sex will hurt. The fear of pain is so great that I can't have sex. How can I get over this?
Well, so first of all, I would not prioritize intercourse. I would prioritize, first of all, pleasure, sensuality, orgasm, right? Like that those are like develop the eroticism. I would also think in terms of um, taking pleasure in your spouse's body, taking pleasure in being touched, not about giving pleasure or you've got to give this to your spouse, because that is going to make the body more reactive and more likely to seize up. Okay. If it's more that you are going to take care of yourself, it helps the body relax and makes the possibility of pain be much lower. Then practically speaking, first of all, you can go and have the vagina be stretched. You can get cones and you can actually stretch your vagina if you're worried about that. The other thing is that if you can do that, or if your doctor says, look, it's very unlikely that you'll have pain, you can reassure yourself that if it starts to hurt, you are in control. This is the thing. This is going back to the brain knowing that you're going to be in control. I'm not just going to have intercourse and then be in terrible pain and have nothing I can do about it. If it starts to be painful, he'll pull out, and I can trust him and I can trust us to work with it. it's very likely just a fear, right? I mean, very likely it's just you're anticipating something, and the more you anticipate it, the more it almost, becomes like certain that it's going to happen, but it probably won't. But even if you start to feel a little discomfort, you can make a decision. Do I just stop here and allow this to stretch me a little bit, or do I have him pull out? And you're in control of that. So I think the more that you both recognize that you are in control and you can tolerate discomfort for your own well-being, that allows you to figure out how you want to handle the uncertainty of intercourse. And again, always prioritize pleasure over any specific behavior. But I'm sure that you're saying, like, I'd like to have intercourse at some point. But the more aroused you are and the more you trust yourself, the less likely that there will be pain. And the other thing I'd say is if there is pain, you can do things about this. Like, you can go to a doctor, you can find out what's happening. Do you need more lubrication? So even if you do find that there's pain, there are many things that can be done to help you from a medical perspective. Okay, everybody. Well, I hope this has been helpful, and I would recommend Dr. Schnarch. I'm trying to think, which one would I recommend? I would recommend The Body Keeps the Score by Bessel van der Kolk. Pia Mellody does a lot of good writing about trauma and overcoming trauma. And Dr. Schnarch wrote a book called Brain Talk. Yeah. Yeah. He also wrote one that's not published about regression, but I'm not sure where to point people to for that one. But anyway, so I haven't read it yet, so I can't, I'm sure it's excellent. It's just one that's an unpublished document. Do you have it, Christy? Do you know?
I can grab it probably really quick, or I'll include it in the email. When this is posted on YouTube, I'll send out an email with a link and all of those resources as well.
Perfect. Great. Okay, thanks everybody. Hope you have a great Thanksgiving, and I will see you in December.